For centuries, dill was more than a spice on the table. It was a go-to remedy for painful swelling and sore wounds. Ancient writers like Dioscorides passed recipes to medieval apothecaries, and everyday households kept dill in pots and jars not just to flavor stews, but to soothe inflamed skin and aching limbs. Early healers crushed the seeds and leaves into warm poultices, steeped them in oil or wine for soothing compresses, or ground them into pastes mixed with bread and vinegar. In simple medical terms, people believed the plant's warming and aromatic oils could calm the hot pain of swelling, draw out irritation, and quiet throbbing tissue. Monks tended herb gardens, midwives and cooks doubled as healers, and market stalls sold bundles of dill alongside remedies for toothache, sprains, and inflamed wounds. You'll see a recreated medieval dill poultice and hear why those kitchen practices sometimes helped. A look at how a single herb threaded through daily life, belief, and practical care long before modern pills existed. How dill was used for inflammation. Dill appears repeatedly in early medical writing and household practice as a plant used to calm painful swellings and inflamed places. Practitioners and household healers understood inflammation as heat, redness, and swelling, the body's angry response to injury or infection, and they turned to dill because its aroma and oils were thought to soothe that heat and ease the pain. Simple explanations in the old manuals describe dill as a comforting herb. When applied to a sore spot, it could soften the swelling and make the area less tender. Crushed fresh leaves were a common first-line preparation. A handful of leaves would be bruised and worked into a soft mass, sometimes mixed with warm boiled bread, oatmeal, or barley meal to form a poultice that held heat and herb together. The poultice was then laid over an inflamed joint, bruise, or abscess and bound in place. Seeds were used in a different way. They were steeped in hot water to create an infusion that could be sipped for deep-seated aches or cooled and used as a compress for inflamed skin. Apothecaries also macerated dill in oil or vinegar to make ointments and liniments meant to be rubbed gently onto swollen areas. Everyday life shaped these treatments. Kitchen and garden were medicine cabinets. Settlers, household healers, and monastery infirmarians grew dill beside cabbages and herbs, and a woman who cooked with it in the morning might reuse the same sprigs that afternoon for a poultice. Barber surgeons and wandering healers would recommend a prepared dill water or a warm dill poultice after setting a dislocated joint, while midwives kept simple dill remedies on hand to relieve painful swelling after childbirth. The techniques were practical. Repeated warm applications, rest, and gentle rubbing with herb-infused oil often accompanied the remedy, not just the plant alone. Doctors who wrote herbals fitted dill into the older system of humors and qualities. It was considered mild and useful for easing the heated aspects of inflammation without the harshness of stronger caustics. Remedies were balanced. A cooling wash might follow a warming poultice, and a soothing dill ointment could be prescribed to prevent the rawness that sometimes followed swelling. That reasoning shaped usage as much as the herb's smells and textures did. A typical household episode shows how these pieces came together. A laborer returns with a swollen wrist after lifting a heavy load. The housewife bruises fresh dill into a paste, mixes it with warm bread, and ties it over the joint while he rests. She prepares a seed infusion for him to sip that evening, and the next day, she rubs a little dill oil into the skin to keep the area supple. Simple actions, repeated over days, were the standard course. The story of dill in early medicine is thus less about a single grand cure and more about practical, sensory remedies woven into daily life. A kitchen-grown plant used in poultices, infusions, and oils to quiet heat, reduce swelling, and ease the pain of inflammation. Why doctors trusted dill as medicine. Dill, Anethum graveolens, earned a place in early medicine because people who looked after the sick saw it ease painful swelling time and again. Its fresh leaves and seeds were full of fragrant oils. Those oils had a cooling smell and a sharp taste, and healers learned that when those parts were applied to sore areas, the redness and heat often let up. Simple chemical components like carvone and small citrusy oils gave dill a gentle effect on irritated tissue, helping wounds and stiff joints feel less angry without harsh side effects. Because it was common in gardens and kitchens, dill was easy to test and keep on hand. Practitioners who made medicines in the household or the monastery used what grew nearby, and they recorded which plants seemed to help. In everyday practice, this mint bruised leaves were mixed with oil or fat to make a salve, seeds were steeped in hot water for a soothing drink, and strong infusions were cooled and applied as compresses to swollen limbs. People trusted these uses because they could see quick, if not perfect, relief. A poultice would draw out heat and pain from a sore spot, for example, and a warm dill drink settled a painful belly. In the workshops of barber surgeons and in village apothecaries, dill was treated as a single remedy whose effects were judged by observation. Doctors relied on a blend of experience and local wisdom rather than long laboratory proofs. They watched how a poultice reduced the size of a bump or how a balm eased a person's movement. That practical evidence mattered most. A patient who could sleep after a dill infusion convinced neighbors more than abstract theory did. Dill's mildness also made it attractive. Unlike stronger herbs that could shock the body, it was unlikely to cause harm when used repeatedly with food or as a packed herb. Midwives and household healers used it in infants and older people alike, stirring seeds into broths or making gentle washes for sore mouths and gums. The herb's dual role in the kitchen and the medicine chest reinforced confidence. If something helped both a meal and an ache, it seemed wholesome and safe. Stories from households and recipe books show how dill tied medicine to daily life. A cook might pluck a sprig to soothe a chef's swollen knuckle, or a father might chew seeds to calm a child's painful digestion before trying a more complicated remedy. Though small, repeated successes built a reputation that outlasted single dramatic cures. Over time, the calm that dill brought to reddened skin and sore joints became part of the trusted repertoire of early healers, grounded in hands-on practice, common sense, and the herb's gentle, observable effects. Did dill actually reduce pain? Dill appears in many old herb lists as a plant used to ease swollen, painful parts of the body, and people commonly applied it to aches with the belief that it could calm inflammation and soothe soreness. Preparations were simple and practical. Leaves or seeds were crushed and warmed, then laid as a poultice on a sprained ankle or a red, painful wound. Sometimes the herb was steeped in hot water and the warm liquid used as a compress. In households and monastery gardens alike, dill was part of the everyday toolkit for minor injuries because it was easy to grow and to prepare at the bedside. Practitioners of early medicine relied on what could be done with the materials at hand, so dill was also infused into oils or mixed with animal fat to make balms that could be massaged into stiff joints. A short application often brought a cooling sensation and lessened the complaint for a time. From a simple physiological view, that effect makes sense. The herb contains fragrant oils that can calm redness and swelling and produce mild numbness at the skin surface, which reduces the perception of pain. Modern laboratory work has identified substances in dill that act against inflammation in simple tests, and animal studies have suggested modest pain-relieving activity, so the herb's reputation was not purely imagined. Everyday medieval treatment culture blended medicine with kitchen practice, so a cook, a midwife, or an apothecary might all reach for the same remedy. Dill could be eaten in broths to ease upset that accompanied pain, or it could be mashed and bound to a wound alongside other common plants like plantain or comfrey. Such combinations were meant to cleanse, soothe, and hold the dressing in place. The hands-on care, cleaning a wound, applying a warm herb pack, and wrapping the limb, also mattered a great deal. Touch and attention lower distress, and the medicinal action of the dill itself worked together with these simple nursing actions. Looking at the balance of evidence, dill probably did reduce pain in many of the ways people described, by calming swelling, gently numbing the skin, and supporting cleanliness of an injury. It was not a dramatic painkiller, however, nor a replacement for stronger remedies when those were needed, but its modest, observable effects made it useful and trusted in daily practice. Even today, the continued use of dill in folk remedies reflects both a real pharmacological basis and the practical value of simple herbal care. We end where we began, a humble sprig of dill, plucked from the garden and turned into relief. In early medicine, people mixed dill into warm teas, crushed it into poultices, and steeped it into oils to soothe swollen joints and hot, painful skin. The simple idea behind those remedies was that the plant's fragrant oils and bitter compounds could quiet redness and ease throbbing, helping the body cool down and feel less hurt. Healers and household cooks alike treated dill as both food and medicine, tucking it into kitchens, monastery infirmaries, and midwives' baskets, using salads, compresses, and rubs as everyday care long before hospitals and labs. If this little history made you look differently at the herbs in your pantry, tell us in the comments what your family used for aches. Like the video if you enjoyed the story, subscribe for more short dives into medieval remedies, and stay tuned. Next time we'll follow another kitchen herb through the cures and beliefs that shaped early medicine.